Audience, today we would like to present our research, which is about a study of strays during COVID-19 pandemic of fifth-year dental students in Thailand, which result in Bangkok and vicinity. In the late December of 2019, an outbreak of COVID-19 occurred. The pandemic affected people all over the globe, including Thailand, which the first case was found and revealed in January last year. A huge concern of the disease is that it was occurred rapidly since it was undetectable and was not so conspicuous that can be firstly detected and protected. During day 2 to 14 of infection of most cases, the symptoms of COVID-19 are quite similar to a regular cold, for instance, cough, shortness of breath, fever, like all of them mentioned, it definitely affects to the way of life, social, economic, which can bring up to an increased level of stress and anxiety, well, especially to healthcare professionals. Before we begin, first, let's start with the definition of stress. Mr. Mahat Nilanpun defines stress as a reaction of physical and psychological that affects a challenge from any circumstance that occurs in routine or from special occasions. Well, so when we talk about being a dental student in clinical practice, we normally can't avoid thinking about stress and anxiety because it's not only take many responsibilities of either like looking after patients or lots of work in examination management, but also to improve their own skills in a limit of time. Well, before continuing, let's bring us back to a previous study by Vidat Achakun in the year 2014. In dental students from all clinical years found that 46% of students had a higher stress level. Well, actually, in each clinical level of each university has a bit different in the ranges of student dental year. In some college, clinic starts in the late semester of year 4, but some places start in year 5. However, for an appropriate ranges of the year, we decided to choose year 5 instead, which has been saying that the fifth-year dental students could be a big change of student status from a young pre-clinic life to more serious clinical practitioners. A study of Gausutta in the year of 2014 using Thai General Health Questionnaire 12 in Sinaprinvilo students also revealed the fifth-year dental students' mental health problem tends to increase higher compared with other dental years for approximately 63% of sample population. So we can say that COVID-19 has impacted our lifestyles as a new disease that we at first didn't know how to deal with. To prevent spreading of the disease, the government declared social distancing and temporarily locked some crowded public spaces down for a while until the situation gets better. And according to the rules, dental clinics also have to be temporarily closed. Students have to stay at homes attended via only online classroom, even though lectures could be run, but some kind of work that have to be operated either like in laboratory or in clinic could not, and had to be paused for long during the unstable situation. Moreover, when getting back to college, COVID brought us have to adapt to new normal life with the new uniform rules, which more complicated. Well, to prevent a risk of spreading for safety, at first it was pretty uncomfortable, but later everyone seems used to it. From the previous mention, so it comes to the main question of our research. How does COVID-19 pandemic during early period affect stress of fifth-year dental students? The objective of the research are first to evaluate stress level, to assess factors contributing to stress, and the last one is to access the source of news that fifth-year dental students who are currently studying in Bangkok University in Thailand receive during the pandemic, together with the ethic exemption, which has been asked and approved already. Materials and methods. Well, our research was designed as a cross-sectional survey study, which collected data via online questionnaires. The data collected from questionnaires consists of 1, demographic data such as genders, ages, student and parents' incomes, and financial. 2, stress level, and 3, the factors related contributing to stress sort of news during the outbreak. Again, with the inclusion criteria, which consists of the fifth-year dental students who are studying in university in Thailand as mentioned, and all of them are be able to read and answer questions in Thai. Data collection. And here's the code of our questionnaire. Because of the limit of time, we'd like to take you to the example of some part of them. After getting into the questionnaire, all participants will be taking these following questions. Take a look at the stress level evaluation form, which was designed by Suanpung Hospital for 20 questions. Here's the example of charts which all participants gave scores of stress level from 1 to 5 and roll number to 20. All score are out of 100, and we'll be later see what level each participant is in. But if there was no situation any number occurred in their life, there's no need for a participant to fill up the number. Now the example of our questionnaire, the stress evaluation. Let's take a look at the first stress level. The first one, low score, from 0 to 23, is the level of stress that could diminish in a short period of time. Moderate score, 24 to 41, is a kind of stress that results from the pressure situation, but not that danger. It could be diminished by relaxing activities. The third one is the high level, from score 42 to 61, is the kind of stress level that can affect daily life and cause some kind of disease, such as hypertension or like gastric ulcers. A person should be in a hurry to reduce his stress. If he could not, he should consult with professionals. And the last one is severe, from 62 to 100, is a level of stress result in physical and psychological illness. Help from professionals is critically needed. Factors related and sources of news. The last section is the score table of factors related to COVID-19 pandemic that contribute to stress and the source of news during the COVID outbreak. Data analysis. All demographic data, stress level, and contributing factors related to COVID-19 outbreak were analyzed by descriptive analysis. Next up, with relationship between stress level and contributing factors related to COVID-19 was analyzed using regression analysis methods. Results and discussion. There were total 6 universities with our population were about 499 people and were collected up to 179 samples as for 35.87%, which is enough to be a nominated study of Jirod Kun in 2014, who said that the amount of 100 population needs nominated sample at between 15 to 30%. As mentioned, so all participants were 179 people of our entire 5th year dental students in Bangkok and vicinity, and most of them were female for 72.07%, and the average ages are approximately 23.7 years old. They are mostly Buddhism and have no any systemic conditions problems. Monthly income. The monthly income section found that students participant monthly income ranges are from 10 to 15,000, and the parents' income are about 100,000 to 500,000 of Thai baht currency. From all questionnaires during the pandemic, found most of people incomes expense relation as follows. From the first rank was the amount of incomes greater than an expense for 36.87%, followed by income equals expense. Next up with the income is less than expense but not in trouble due to the accumulated reserve money. And the last one is the income is less than an expense and was in trouble because of the inadequate reserve money respectively. In this study, found most participants had stress level 3 for 41.34%, followed by level 4 for 38.55%, compared to a previous study in normal situation that mentioned before by Kun Virat Ashakun of year 2014. The tendency was shifted to more severe stress and less in a low and moderate level. This could be interpreted that stress level in COVID-19 pandemic was increased. However, the research mentioned it was collected from 4 to 6 dental students, not just year 5 like ours. So further investigation in other clinical years should be conducted and performed. Also, a similar study in students from Faculty of Public Health and Allied Health Science at Prabhalom Rachanok Institute by Suwanapan reported more students had lower stress level. Most of the students presented with level 1 for 61.5% related to their risk perception at low and moderate level. This might cause by the difference of education system between those two faculties. factors related to pandemic that contribute to stress. The graph up here is a descriptive analysis when considering the factors affected to stress during pandemic was finally found that people concerned about the inadequate time and duration in clinical practice, mostly in high level, in which other just in the moderate. Other questionnaires selection found all of three factors about timing in clinic are mostly concerned in high level of anxiety, in which people worry that they may not able to achieve the minimum requirements needed for graduation. But in previous studies, found factors that affected them most was patients could not come or canceled an appointment. Moreover, the result of all factors that make them get straight is definitely related to result of the contributing factors related to pandemic that make participants straight, all because colleges were temporarily closed for a stable period of time for maximum 54.6 approximately. Anxiety factors affecting stress level. Moving on to the relationship between level of stress and contributing factors, found that the most affected is people concerned about the effect of duration for clinical practice, which had odds ratio at 7.98%. By increasing this factor, stress level will be increased for 7 times. And the next phrase, worry about deteriorating health because you're not able to go out for usual exercise, had odds ratio at 2.353. By increasing this factor, stress level would be increased for 2 times. And finally, considering sources of news, the most used channel was Twitter, followed by Facebook. Means that if we announce from this kind of applications, the news could reach maximum for 79.33% of our entire fifth year dental students. In conclusions, as mentioned, the phrase concern about the effect on the duration for clinical practice mixed up with the phrase worry about deteriorating health because you're unable to go out for usual exercise. Both all affect stress level to increase during COVID-19 situation. So this might guide us to an appropriate intervention to reduce their stress and prevent its consequential damage. Also, further investigation might be eventually expanded to other college years just to verify whether the intervention is sane or not. Last but not least, our research couldn't have come this far without all dental students who participated in the study, College of Dental Medicine of Rangsit University, and also especially thanks to Mr. Panik Senaritikai for all statistical analysis advices, references. So that's all for the research. Before leaving, we'd like to say thank you our advisor, Ajahn Landawan, Ajahn Natut, Ajahn Ket Kanya, for all good advice and kind support. And finally, also thank you, Professor sitting here as a committee for corporate listening and attention. We're open for all comments and recommendations. Thank you. Sawadee krap.
Okay, thank you very much, Dr. Prachaya, for your very nice and informative presentation. Okay, so a lot of information from this project, right?
Yes, I think. Definitely yes.
Is there any question from participant? Okay, maybe no any question. Dr. Prachaya, why your target group, the fifth year dental students? Why your target group is only the fifth year dental students?
Yeah, because all of college around Thailand, all dental fifth year dental students are in clinic and has lots of work to manage. So I think this is an appropriate range to choose.
Mm-hmm. So, and how many universities that you have sent the questionnaire to the fifth year dental student?
Actually 12, but we made up from only 6 universities around Bangkok and vicinity because like some time. So think is 6 university could be the answer. I mean, much better than all 12.
Mhm. Okay, okay. So in this project have a lot of information.
Yes.
Do you have any idea the 5th-year dental student to have released test? You
Excuse me,
have any
I think,
recommendation or have any suggestion?
could you repeat the question, because I think there's something wrong on your connection. I don't know.
Okay, can you hear me now? Can you hear me?
But like some word disappeared.
Some word disappear. Okay. Do you have any recommendation or suggestion to help the 5th-year dental student to reduce the stress during this COVID-19 pandemic situation?
I think like all of us have something that we love or we like during the outbreak, during that we have to like spend time at home. We have to do something like we love. and some management.
Okay, just enjoy life, right?
Yeah. Let's just live your life quite well during the quarantine. And when you get back to the college, just live your life on working as well.
Okay. Thank you. Thank you for your suggestion. Okay. So we come to the end of, okay, you can say more.
I mean that's all. I mean what I just say is just from my opinion. Maybe not 100% correct. Hello.
Okay, thank you.